Everyone, back at it again. Dr. Morales and my coordinator, Linda Marquez.
Hi guys.
Hitting another a very, very hot topic as far as patient requests and what they're calling our practice about. And that is options for a tummy tuck. And what are the options? And so I think Linda probably gets this at least 10 times a day. So I don't want to kind of take her thunder. I'm going to let her kind of chime in what the most common question is. I'm going to let her go for that one.
So the most common question I get is, am I a candidate for a mini tummy tuck? We all want mini tummy tucks. No one wants a big scar. No one wants a downtime. And so everyone thinks they're a candidate for a mini tummy tuck.
So the mini tummy tuck, in reality, surgically what it does is that most women may have a C-section scar. That's typically where it lives. And you have a little bit of fullness over the C-section scar, the kind of little baby bump. And a mini tummy tuck is basically just taking that skin and just pinching it down. And so it's a little bit longer than a C-section scar. So the area of address is actually very small. It's not very small. It's not very big of an incision. Very, very few women who are calling for mini tummy tuck are actually true candidates for mini tummy, and that's why I have to see you. So typically what happens is after having children, you get really diffuse stretching of your entire skin. You lose abdominal tone. You get a little bit more full in your abdomen than before pregnancy, because babies stretch your abdomen. It's just unfortunately the price you pay as carrying children. So C-section scars typically are removed with a standard tummy tuck, and the incision length is always a hot topic that Linda gets about. Like, how long are my tummy tuck scars going to be? And and her answer is,
it depends on how much skin you have.
Exactly what it is. It just depends on how much skin you have. And so for me, I'm not going to limit the incision length to here when you have extra skin on your hips, and then you end up having two bulges on the side of your hips, and those are commonly called as dog ears. I do not like dog ears. I don't do them. You just make the incision long enough to appropriately reduce those fullness and then remove the extra skin. It's an extra skin issue. So the spectrum of a tummy tuck can go from a mini tummy tuck to a little bit fuller to hip, sometimes to past your hips, just on the side of your hips. Something goes all the way around you, and that's called a body lift, including a tummy tuck. Sometimes for women who've had lost like hundreds of pounds, right? Massive weight loss, Linda gets called on this all the time. Lost, 200 pounds, and I'm ready to get all the skin off.
Yep.
They have skin in this dimension, extra, but they'll have skin in this dimension, extra. So when you have it in this dimension, I need to actually remove it in that dimension, which makes an incision down the middle. And that's called a fleur-de-lis abdominoplasty. And it's the extreme version of body contouring with massive weight loss specifically. It's not something I'm gonna give you just because you're coming in for me. It's only do things you need. So in my practice, I do everything what I need to get done with the shortest part as possible and get you faster into recovery, give you the results you want.
Absolutely.
So in general, those are kind of the ideas with a tummy tuck. It's a very powerful surgery. You're restoring the abdominal tone typically. You're removing all that extra skin and stretch marks you've had from having children. And I typically contour your waistline to give you a little bit smaller of a waistline to improve your silhouette. So if you're interested, just give us a call. Linda would love to answer your questions. And thanks for following.